In the wake of the Supreme Court decision to overturn Roe-v-Wade, some Republicans in Wisconsin are pushing for more funding for crisis pregnancy centers.
A coalition of 38 Assembly Republicans wrote a letter to Governor Evers asking him to push $10 million of federal pandemic stimulus funds to the centers. Political reporter Will Keneally has more.
So Republicans say that funding for the crisis pregnancy centers provides women access to health care resources, but advocates say that those resources can be limited.
Not every crisis pregnancy center is the same, but most of them provide only a very, very limited spectrum of potential like diagnostic care.
That's VP of External Affairs for Planned Parenthood, Mike Murray. With all the attention on abortion in the wake of the Supreme Court decision, it can be easy to forget some of the other services his organization provides.
We provide individuals with well person screenings to make sure that they are able to access life-saving cancer screenings, able to receive testing and treatment for STIs.
But 38 Assembly Republicans signed on to a letter asking Governor Evers to put $10 million in ARPA pandemic funds towards crisis pregnancy centers, which they say help women navigate pregnancy.
And just with what happened at the Supreme Court last week, I think it's important. There'll be more services needed here by women around our state.
Senator Roger Roth sits on the Senate side, but supports the funds.
I think the state has an obligation to step in, make sure that they're adequately funded.
Evers is sure to reject the proposal, but as with most things during an election year, that could change drastically if a Republican beats Evers in November.
And what it would go to has nothing to do with health care. There aren't doctors or nurses in those facilities. They're not there to treat people.
So Planned Parenthood says a better use of the funds would be to increase health care across the board, like expanding Medicaid, which is something that Republicans have traditionally rejected. For his part, Roth says he wants to see the money make the most impact by getting into the hands of clinics on the ground.